Hello there, and welcome to EPA Insights. I'm Brad from the assessment team here at Highfield, and today I'm going to talk to you about the Level 5 Leader in Adult Care Standard IFATE version 1.0 Assessment Plan APO2. We want to be able to share with you what we've learned since assessing on this standard. This includes an analysis of the grades and looking at any common trends, while gaining assessor feedback and customer feedback where we may have had queries before in the past. We hope that you find this useful. The assessment is made up of two assessment methods. These are a 90-minute observation of leadership and a 90-minute professional discussion. We'll also finish off the presentation with some general hints and tips for the endpoint assessment. The observation of leadership comprises of a 60-minute observation followed by a 30-minute questioning session. Learners need to submit the observation plan at Gateway for the assessor to review and approve. The observation plan will need to be a suitable workplace activity and have the scope to meet all the assessment criteria. If the assessor cannot approve the proposal, they will contact the learner directly to discuss this, as it may be possible to make and agree any adjustments over the phone. The observation must include the ability to demonstrate leadership to an organisational audience, and the learner should prepare for this in advance with the relevant parties. We analysed a proportion of learner reports where learners had failed to pass the observation of leadership. For each assessment criteria, you can see the proportion of learners who have either passed, failed, or not attempted the assessment criteria. The high proportion of red shows where learners have attempted but unfortunately not passed the criteria. We will take a closer look at these on the next slide. Let's look at some of the criteria learners are attempting but not passing, starting with the most common areas of failure during the observation. K12.1 identifies and applies relevant models of monitoring, reporting and responding to changes in health and well-being. The trap with this one is not fully understanding what is being asked for. To prepare, answer a minimum of 4 questions relating to how they have considered models of monitoring and reporting, safeguarding, current legislation and regulation, and responded to changes while demonstrating leadership. S5.1 demonstrates that leadership models have been referenced in their approach to co-production when encouraging and enabling the team and people who access services. The issue and trap with this one is not identifying those leadership models or understanding co-production and how to adapt to that. In order to prepare, identify how they have used leadership models when working with teams and service users, during team meetings, supervisions, huddles and care plan reviews, utilising the skills of others. S16.1 applies the evidence-based practice around current drivers in the adult care landscape to their own setting. The trap with this one is not understanding evidence-based practice or drivers in their current own care setting. In order to prepare, understand what evidence-based practices or drivers are in your current care setting. Provide examples such as care certificates, apprenticeships, a training matrix, structured supervisions, appraisals or research. Now let's move on to the professional discussion. So this is an in-depth two-way discussion between the apprentice and the endpoint assessor and should last for 90 minutes. Professional discussions should take place in a private space where they won't be disturbed or distracted. The assessor will ask a minimum of 1 question for each of the knowledge, skills and behaviour groups that are mapped to this assessment method. The professional discussion will also be audio recorded. Moving on to some of the key points. Some apprentices fail to talk about key terms in the professional discussion. Ensure you are familiar with all the learning outcomes within this assessment method. When discussing past criteria, focus on explaining how you have met the criteria and describe the actions you have taken. When attempting the distinction criteria, ensure you analyse or evaluate where applicable to demonstrate a greater level of understanding. We analysed a proportion of learner reports where learners had failed to pass the professional discussion. For each assessment criteria, you can see a proportion of learners who have either passed, failed or not attempted the assessment criteria. The high proportion of brown means that learners did not have the opportunity to attempt the criteria. We expect this to happen with distinction criteria if there was not the opportunity due to time constraints. We've identified other criteria where there are higher rates of learners who have attempted the criteria but unfortunately not passed. These seem to be the most common causes of failure within the professional discussion. Let's take a look at some of the most common areas of failure within the professional discussion. Case 17.1 identifies and explains theories of management and leadership and their application to adult care. The trap with this one is not identifying the correct leadership styles or theories. In order to prepare, identify and explain different management and leadership models and theories and how these have been applied in their care setting. This may include transactional leadership or transformational leadership, for example, autocratic, democratic, coaching, pace setting, and laissez-faire. K4.1 describe the change management theories, processes, and tools used. The trap with this one is a lack of understanding of the change management theories and tools. In order to prepare, identify different models and how these have been implemented. Learn about KPIs, SMART targets, and CQC outcomes, and how these goals have been set and what actions have been taken as a result. K6.1 explain theories and models that underpin performance and appraisals, including disciplinary procedures. So the trap with this one is the learner's inability to explain the theories and models used when managing performance. So in order to prepare, explain how they have used various models to manage performance, such as team types and models of supervision. Refer to the care settings appraisal and disciplinary procedures. S11.1 explain safeguarding principles across all organisational policies and procedures. The trap with this one is that some learners provide the safeguarding principles but are not confident relating them to their own policies and procedures. In order to prepare, identify policies and procedures from within their setting and explain how the safeguarding principles apply to these. K10.1 explains safeguarding principles across all legislative, local, and national requirements. The trap with this one is that learners often overthink this criteria and struggle to relate to legislation including local and national requirements. In order to prepare, consider CQC and local safeguarding authority requirements. K18.1 identifies the knowledge of key elements of effective team performance. The trap with this one is a lack of understanding of how an effective team performs. In order to prepare, consider how different team members' knowledge and skills are utilised. Also consider the quality of care and working in a person-centred way. Finally, moving on to the general hints and tips. EPA reports, so all learners will receive an EPA report. Use the EPA reports to analyse if there are any emerging trends and patterns of any particular area or assessment criteria your learners will struggle on. This will help you to refine and continuously improve the quality of your learning programs. Learners can take their notes into their professional discussion. Having good quality, real-life examples that can demonstrate how the assessment criteria has been achieved can help the discussion flow more smoothly and allow time for the adequate exploration of all the assessment criteria. There are lots of helpful resources available, including EPA kits with amplification to further describe the areas that will be assessed. Think About documents can also help learners to prepare for the endpoint assessment. And last, but certainly not least, mock assessments. These are a key tool at any level to help learners build confidence and practice. Ideally, carry out a mock observation, question and answer session, and professional discussion with someone that they are not familiar with to help them prepare for the big day. And that's all from me. Thanks for watching.